breaking news. A possible case of hantavirus here in Illinois. It is important to note this is not in any way connected to the cruise ship outbreak. The Illinois Department of Public Health says that case is tied to a person in Winnebago County, which is in the Rockford area. The resident may have contracted the virus while cleaning a home that had rodent droppings inside of it. The CDC is now doing some official testing to confirm that it is, in fact, hantavirus. Health officials are stressing that this is the North American strain, which does not spread from person to person. With hantavirus making so many headlines, we wanted to bring in Dr. Katrine Wallace. She is an epidemiologist at UIC, and she's going to help us better understand the situation. Dr. Wallace, thanks for being with us. First of all, quite a hot topic. I'm sure you're hearing about it all the time.
Yes, thanks for being here, for letting me be here.
Absolutely. So we've all been focused on the cruise ship for now, and then we hear from Illinois officials talking about this case out of Winnebago County. What should we know about the North American strain, and why does the distinction matter here?
Yeah, the distinction matters because not all hantaviruses behave the same way. This Illinois potential case appears to involve a North American strain, which is spread from rodents to people through, as you said, exposure to infected droppings or urine, and does not spread person to person. The cruise ship outbreak involved the Andes strain, which is found in South America and is one of only the few hantaviruses that has shown limited person to person spread. So public health officials want people to understand that this Illinois case, potential case, is not connected to the cruise ship and does not suggest there's some kind of widespread community transmission in the U.S.
Right. It does seem like the experience on the ship is an outlier sort of in size. But how common is the hantavirus in Illinois, let's say in any given year or couple of years? Does it show up?
Yes, but it's very uncommon. In Illinois, we've only had 6 cases since 1993 when we started tracking it in the U.S. Nationwide, there's been fewer than 900, and they're mostly in the western United States. So while these headlines are understandably, concerning, the overall risk to the public does remain very low.
Good news there. If anyone is possibly like this person out of Winnebago County cleaning a home, or maybe there's mice or rats and their droppings, are there precautions that people can take to protect themselves?
Yeah, absolutely, yes. The biggest thing to avoid is stirring up rodent droppings into the air. So people should not sweep or vacuum dry droppings because that can aerosolize the virus. Instead, if you're cleaning an area where there has been an infestation, wear an N95 mask, wear gloves, ventilate the area. You can spray the droppings with a disinfectant or bleach solution and let it soak, and then wipe it up with paper towels. It's also important to seal up holes where rodents can enter your home in the first place.
Lastly, doctor, with some of the information you shared and other experts are talking about, the math here basically supports the idea that this will not in any way lead to a COVID-like crisis. Can you explain why that is?
Sure, yes. The hantavirus is a very different virus from COVID, and COVID spreads extremely efficiently through the air between people, including people who have not had any symptoms, right? So most hantaviruses in North America don't even spread person to person, and even the Andes strain that affected the cruise ship appears to require much closer and prolonged contact than COVID-19 did, the virus that caused COVID-19. And hantavirus is also much rarer and depends on a fairly specific type of exposure to infected rodents. Even though the Andes hantavirus strain that affected the cruise ship, the predominant way that is spread is from rodents to people and not person to person.
Dr. Katrine Wallace, thank you so much for your expertise and all this great information. We appreciate your time.
Thank you so much.